Hello viewers, welcome to Medical Media Kenya. This time round we are going to discuss about dental health. I'm joined by Dr. Caroline Cherono Tanui. She's a dentist in one of the busiest dental centers around this region at Tenwek Hospital. Welcome to the program.
Yeah. Thank you so much, Dr. Tutis. I appreciate this.
You're welcome.
Yeah.
You're welcome. So we'll start off just to discuss about common dental problems in children. What are these dental problems that are common in children?
Actually, there are a couple, but top on the list is dental cavities, and then we have gingivitis, and there's also dental trauma because children are involved in playing. They're very playful at school and at home. They're also prone to trauma. And then there's also tooth malalignment, where because their tooth was not shed at the right time, there's now malalignment with the teeth.
Okay.
Yeah.
Great. So, about dental caries, what is that condition, and just tell us more on that.
So dental cavities, commonly known to us as tooth cavities. Yeah, it's an infectious disease that is caused by a bacteria that actually attaches to the tooth. And then this bacteria, they feed on carbohydrates and sugars that we eat from our common diet. And then once after they feed, they secrete some bacteria out of metabolizing that product. Now this bacteria actually begins to erode the tooth, sort of to dissolve the tooth, such that the mineral component of the tooth is lost. So over time you will notice initially it's a white spot, then it becomes yellow, then it becomes black, and a lot of times when the tooth breaks off because it's weak. Yeah. And there are many components towards what dental cavities, what contributes to dental cavities. It's the high intake of sugar in our diet. Yeah, carbohydrate being the main source. And there's also the time factor. So you realize that if you take carbohydrates frequently, the child really snacks really frequently on very refined sugars like the crisps, the sweets, all the candies. That's very good food for the bacteria. So we have to really be very careful of what we give our children. Yeah.
Thank you for that. So, how can we prevent these common dental problems in children, especially the tooth cavities?
So even before we go to the prevention measures, there's something I wanted to mention concerning nursing bottle caries. It's still a type of cavity, but it's very common with children under the age of like 3 years. Those children who are still breastfeeding and are still using the nursing bottles. Yeah, and maybe sometimes some parents will leave the baby to use that overnight and supervise it such that the baby sleeps with the bottle in the mouth. So it's like the milk pools over, so the teeth are literally just floating in the milk, which the milk has good the sugars. And then over time you realize that these children that like 2 years, but you notice they have black teeth, especially the upper one. So that's also another very common occurrence with children. So to prevent this means that we have to ensure good oral hygiene. And contrary to what we think, oral hygiene actually begins way before the teeth even come to the mouth. Because most of the time we are thinking once the child is going to school, so then I get the toothbrush, you're meant to brush your teeth. But this good oral hygiene, which is part of the prevention, should start way early, such that when a baby is like even 6 months, when the eruption of the deciduous, the milk teeth, start erupting one by one, after feeding that baby, it's very important that the mothers learn to just clean. The caregiver should be able to, use just some very thin cloth, dip it in some warm, clean water, and then you clean for the baby. Especially before, the last, because babies keep breastfeeding at frequent times, but the more frequent you actually help to clean, that will prevent, so that your 2-year-old will not have maybe full teeth. And then another aspect about the good oral hygiene habits it starts with, like, as you start to train this child, even before they even know what a brush really is, they keep noticing, hey, mom usually cleans for me, after every meal. And if you inculcate these habits into the children get to know, they become they begin to take the initiative. And it's not just brushing, because there are many times, the parent will come and say, I brush for this child every day. It's in the type of brush that they say. Yeah, I try to use a good quality brush that is soft so that it does not injure the gums. And then also part of that is you need to brush after the meals. Not because most people also brush before breakfast and you don't brush. That's a common, very common. So you have the child, brush, and then after that so we are also got to have to the frequency really matters also. Yeah, in trying to prevent. And then of course what we've said about the sugar. Because I think we are very fond of packing for our children snacks when they're going to school. I think it's high time we reevaluated what we actually pack for them. If it is juice, biscuits, all that, we need to change that, because the other healthy alternatives, like fruits, vegetables, sandwiches are very good. Because with the sandwich, you put the lettuce and all that, and that's a healthy snack that a child can actually carry to school. Yeah. So that's in terms of dental caries. It goes back to oral hygiene habits that we build in our children. That even when they go to boarding school or they're away from home, they know that this is something has been taught and the reason why. Yeah, because also behind it prevention, knowing the why is very important. Yeah.
Thank you so much. So, just a parting shot about children. Or is there anything specific for like teenagers that is different from the younger children? And what can you just tell them about oral hygiene that the child themselves can do? Yes.
Yeah, so I would really say it still goes back to the oral hygiene, that it's a primary responsibility as a teenage child who's going into adulthood. You need to keep, the high standards of the hygiene. Yeah, and then also to be able to regularly see your dentist, which is very important. That because when a problem is detected very early, actually it can be solved. Yeah, so it's really important that even these teenagers, and even for parents with the younger children, even when we don't have to wait for pain, that my child has a tooth pain or my child has dental cavities and I seek the dentist. It should be something I feel like even it's twice a year, but you can make it even like termly. Once the term closes, take your child, before school opens, just, so that you can be able to, detect problems early now.